Hey guys, Dr. Sampson Davis here in the emergency department. I'm working clinically today. Now I just have an ambulance rolled in right behind me with a trauma patient who was hit by a car. And it took care of the patient, thankfully saved his life, and he's going to be okay. But that incident had me thinking about some of the recent things that we've seen in the news, most recently the Olympics, which was a fantastic ceremony for us because we won so many medals. But I know you recall that one incident where it was that gymnast, he was flipping and he landed and you saw his leg just snap and pop on TV. And the ambulance crew came and picked him up and transported him and dropped him So it had me think about what do you do when a trauma unfolds, whether you're hit by a car, you're shot, you're stabbed, or you fall from a building. The most important thing that you can do for that person, that loved one of yours, is call 911. You do not want to pick them up. Years ago, it was a movie called Kramer versus Kramer, where the father was at the playground with his son fell from the monkey bars, and he picked his son up and ran to the hospital because he had a head injury. So that is not what you want to do. Very important not to move a person when they are involved in a trauma. You want to make sure you keep them lying flat on their back. You do not want to shift them, because one sudden move, if there's any sort of spine or back potential injury, it can cause impression or a compression or injury to the spinal cord and cause instant paralysis. So when you're brought into the emergency department for a trauma-related incident, most often the ambulance crew is going to put a cervical collar on your neck. They're going to put you on this long sort of stiff board, which we call a backboard. So you often are what we call backboard and collared. You are brought in, and at that point I will examine your cervical spine, your neck area, and your back area and your lower spine area to make sure there's no injury there. Once I determine there's no injury, then your spinal cord is cleared and you're free to get up and move and shake and bake. But until then, it's very important that if your loved one or a friend or a stranger for that matter is involved in some sort of accident, a car accident, a fall, gunshot, stab wound, any sort of trauma-related injury, that you do not move the person. You can cause more harm than good. And for that gymnast who was dropped with a broken leg that was already displaced and fractured in so many different ways, that was sort of adding salt to the injury. So make sure you do the right thing and always do no harm. Call 911, keep the person lying still, do not move them from the site of injury. Let the professionals or the people who are trained come in and take care of that person.